Welcome to this video on pandemic preparedness and response, global strategies for emergency management. I am Dr. Nasser Hassan, an emergency medicine consultant. We begin with the foundations, defining the threat landscape and the life cycle of global infectious disease outbreaks. Surveillance and detection rely on early warning systems. This includes syndromic surveillance in emergency departments, global intelligence sharing via networks like GPHIN and GOARN, and rapid diagnostic speed for novel pathogens. The WHO pandemic life cycle has 4 periods. Interpandemic focuses on animal to human risk. The alert period confirms human infection clusters. The pandemic phase involves sustained community transmission, followed by the post-peak transition to recovery. Surge capacity is managed using the 4 S's framework: staff, health, and support. Stuff like PPE and oxygen. Space, utilizing areas for triage and care. And systems, which involve HICS activation and modified care standards. Flattening the curve is essential. The strategic use of non-pharmaceutical interventions, or NPIs, protects critical infrastructure by reducing the peak demand on the healthcare system. Infection prevention focuses on protecting the healthcare workforce. Key areas include strict PPE discipline, engineering controls like HEPA filtration, and administrative measures such as rapid triage of respiratory patients. Medical countermeasures, like vaccines and antivirals, are the ultimate exit strategy. Focus must be on maintaining the cold chain, ensuring logistics for last-mile delivery, and prioritizing equity in distribution. In triage and ethics, the goal shifts from the best outcome for the individual to the greatest good for the greatest number under crisis standard of care. Resource use becomes strictly rationed. Transparency is the currency of trust during a public health crisis. The speed of communication must match the speed of the pathogen. Key performance indicators, such as the transmission goal of RT less than 1, the case fatality rate, and the bed occupancy threshold, allow for dynamic public health adjustments. Remember that preparedness is a process, not a destination. Thank you for watching this video. You can contact me, Dr. Nasser Hassan, at the email provided. Here are the sources for the images used throughout this video.